I find that very interesting based on what you just told us. You can certainly see the many advantages that you just listed there. Dr. Ghorbani, certainly minimally invasive, only takes about 20 minutes. Basically, one is looking at immediate relief and a very high success rate with very little to no scarring as a result.
And that's what makes it a very cost-effective and important procedure.
Now, I wanted to ask you, what's the typical process that a patient would be looking at, Dr. Ghorbani, if they were to undergo this treatment option?
Obviously, the first patient has to be reevaluated. MRIs, recent MRIs of the back has to be done and reviewed. Patient is taken to the operating room and placed on their stomach on an operating room table. It takes about 10 to 15 minutes to get a perfect picture of their back, and using puncture hole with a 2 millimeter width needle, we're able to access this disc, which takes about 2 to 3 minutes. Through that needle, we insert a device which is like a mini rotor-rooter.
Interesting term.
Yes, and it spins the tip of this mini rotor-rooter, and by spinning, it sucks out a piece of disc that was herniated. It takes about 1 to 2 minutes for the actual procedure.
Oh, so we're only talking 1 or 2 minutes for the actual procedure like you just mentioned. So most of the time, the other 17, 18 minutes or so are in the setup and everything else that you just touched on.
Exactly. After the procedure is done, patient is taken to the recovery room, and within half an hour, since they only had local anesthesia with sedation, they're able to go home. We recommend for the patients to take it easy that day, and by next day, most patients have relief of their leg pain that they suffered from for months, sometimes even years.
They can get back to work or do the other normal things that one does on a daily basis in a pain-free manner as opposed to what they were suffering from before.
Exactly, and with a Band-Aid rather than having a big incision on their back.
We're now going to meet a patient of Dr. Ghorbani's. Welcome, Sandra.
Thank you.
Oh, it's our pleasure. Let me begin, if I may, by asking you, what type of pain were you experiencing?
Well, I was experiencing severe back pain and leg pain. The pain was so unbearable that it was impossible for me to sleep at night. I would go to bed with the pain and wake up with the pain.
So, in other words, it wasn't just restricted to your lower back area, or your back area, I should say, but you're talking about, what, I take it, shooting pains going down your leg?
Oh my God, yes. Yes, they were unbearable. I couldn't stand. Walking was just really, really bad for me. I just thought that my life was over.
So it sounds like it was excruciating.
Yes, it was.
And how did this problem come about?
Lifting luggage on my job.
Oh, so it was work-related.
Yes.
What's the step that you took to rectify this problem?
Well, I went through physical therapy. That didn't help. I went to other pain specialists with no results. And then finally, I came here to see Dr. Ghorbani, and he did a back procedure. And afterwards, the very next day, it was like I never had the leg pain.
Oh.
I mean, I forgot that what I was actually here for. The pain was gone completely. And to this day, it's gone. I've gotten my life back.
You're back to normal.
I'm back to normal.
And all within a day, basically.
Isn't that something?
My God.
It's amazing, it's good.
We're certainly very happy to hear that. Sounds like you're a new you again.
I am, and I just thank the staff here that they're so professional, they're so warm and caring. I love Dr. Ghorbani. I talk to everyone about him. Thank you, Dr. Ghorbani. I want to thank him so much.
Well, I'll tell you what, that says it all right there. I don't even have to ask you how you feel about the results because you've already said it. Your face and the
I'm happy.
Happiness that you're exuding
Yes.
is 1,000 words.
Yes, thank you.
And it's certainly our pleasure having you on with us today and sharing a few of your thoughts and experiences. And on that note, I'd like to thank you, Sandra, for joining us and being a guest on A New Me.
Thank you so much. I just want everybody to know that you do not have to live with pain.
Thank you. We're now back with Dr. Ghorbani. I must say she seemed very pleased with the results. Certainly sounds a lot better than she did prior to this procedure.
And I'm very pleased that it worked very well for her.
Are there any follow-up visits required?
Usually after the procedure is done, we'll have the patient to come to our office about a week later for a routine checkup. And about 3 to 4 weeks later, we start them in some sort of physical therapy if they feel that it's needed. But otherwise, they're back to normal life and they can return if they ever need to.
Now, we've only got a few moments left, Dr. Ghorbani, and I have to ask you, before I let you go, if you have any final thoughts you'd like to share with our viewers.
Spinal discectomies and decompression are becoming less invasive in the recent years. Unfortunately, there are only a few doctors who are trained to perform these procedures. It's very important for patients to go to a facility that they're trained doctors specifically to do these procedures. We are now in the forefront of truly minimally invasive surgical treatment of spine disease, and the future seems very promising.
Well, that was certainly a very helpful interview, and I want to thank you on that note, Dr. Ghorbani, for joining us again and being a guest on A New Me.
Thank you very much for having me again.
It was our pleasure.